Zweli Mkhize says he's noted media reports in which various stakeholders have made public comments regarding the National Health Insurance Bill. Mkhize has called for interested parties to engage with the consultative process on NHI. Well, for more on this, I'm joined in studio by Dr. Anban Pillay. He's the DG in the Department of Health. Thanks very much, sir, for joining us.
Good afternoon to you and to your viewers.
Good stuff. So, to what extent is the department and to what extent are you concerned about this talk that professionals are contemplating leaving the country, with some even apparently having left the country already because they're concerned about what the future of an NHI will look like?
I think globally it's important to appreciate that there is high levels of migration of health professionals. Professionals generally move from less developed countries to countries of greater development and economic growth. So we, for example, inherit a lot of immigrant doctors from countries within the African continent.
Yes.
And similarly, doctors from South Africa move to wealthier countries. So migration is not a new concept in the health system. When the NHI had been introduced, you would notice that it's a radical change to the way the health system is being structured. And so many people respond to this radical change in a manner that instills fear in them because they don't know what the unknowns look like.
They respond radically.
Yeah. and so I think the initial response may be this, but I think it's important that doctors understand what the system is about. Many who you speak to actually don't know what's in the bill. They've heard somebody say something that's actually not going to be implemented, but they believe it.
Yes.
And so when asked, are you going to leave, they would say yes.
Yes.
So our role is to meet with doctor groups and get them to understand what we're going to be doing, that we need to work with them. If we want to implement an NHI, we need a funding system, we need health professionals to deliver services, so we all need to work together.
Yes.
And so trying to find a solution to these challenges is what we need to do. So we're not in the business of driving doctors out of the country.
Yes.
So we will obviously work with them to do that.
How does that consultative process work? I mean, are you going around to different parts of the country to talk to all these professionals, or are you just speaking to organizations?
So largely we work through organizations, and we call meetings, and we usually meet with the health professionals like doctors in various cities around the country. Not all professionals obviously attend these meetings,
yes.
And often you may find that these are the people that are responding in this manner. So we've now embarked on quite an effective communication campaign to try and reach everybody, and also get people to reach us to say, I have this concern about the NHI, is this going to be the way it's implemented, or is it something else?
Yes.
So I think it's about answering some of these questions, which I think will settle the minds of many health professionals.
It's very important that as media, that we are also responsible in how we report this issue, which is, like you say, radical, and there are a lot of fears around it. But when you communicate with these health professionals, do they come to you round to your way of thinking? Because it does seem as though, I'm sure there are a number of professionals who've read the bill, but they're still anxious because, you know, we know that a lot of institutions that have been run by government have not done so well. And so perhaps there's a fear that this will be replicated.
Yes, I think there are aspects of the bill that people are concerned about. It's not what's in the bill. It's more about the detail of how those aspects will be implemented. And we've indicated that this is going to be a journey of many years. And through this journey, we will be holding hands with them in the implementation, which means that as we implement a policy, we will consult, understand their concerns. They'll understand why we're doing what we're doing. If they can give us an alternative pathway to achieve the same objective, then we don't see a problem with doing so.
Yes.
But at this stage, we've actually engaged on an approach that we found in the evidence internationally to have worked the best. But that doesn't mean we're close to any other views that may be out there.
So in the meantime, what is it that government is doing to kind of anticipate the numbers in terms of staff complement that will be needed when the NHI starts running? What are you doing maybe to get the young stock that are coming through to ensure that you've got enough people trained and ready for NHI?
So we've increased our training of health professionals. For example, this year we trained, we brought into the system over 900 additional doctors. We usually train 1,200, but we've now had over 2,000 doctors coming into the system. So we've increased the number quite substantially, and we'll continue to do that for many years going forward, and other health professionals as well. But I think it's not only about bringing on more health professionals, it's also about making sure that the right level of care is being provided.
Yes.
In the private sector, for example, a lot of care is concentrated in specialist groups, and some of that care could happen at the GP level, some care could happen at a primary care nurse level, etc. And about making sure that the right level of care is involved in that, because it's a very efficient system to run like that, rather than having all the care at the highest level, because it costs a lot of money.
Yes. Yeah. So what is the future of medical aids? Because obviously there's a lot of worry there, since government is going to be a bulk buyer of medical services.
Yes.
There, and even low-income groups are apparently being advised to avoid getting medical aids in anticipation of NHI. So what will their role be, and are they going to still be able to be effective and relevant?
So medical schemes currently exist in terms of legislation, the Medical Schemes Act, and that act makes it a voluntary purchase. So in other words, participation in a medical scheme is voluntary, and those that participate choose a package based on what they consider to be an appropriate level of service for their health risk. Under the NHI, the fund will be paying for a number of services from primary care through to hospital level care. So when people have the full NHI package, they'll make decisions about what services they think they need additionally, and then they may purchase medical scheme cover for that, or they may not, because they may consider it to be adequate in terms of the NHI package.
Yes.
So medical schemes will remain there, and they'll remain a voluntary package of services.
Thank you very much, sir, for your time. That's where we have to leave it. That was Dr. Anban Pillay. He's the DG in the Department of Health.